In many African countries, we have a thing we like to do called turn to your neighbor. So please turn to your neighbor and say, thank you for fighting the good fight.
Thank you for fighting the good fight.
Thank you.
It's across so many countries, so I'm just bringing a part of it here today. And I'm joined by neighbors from the continent and beyond for this really important conversation. And I'd like to set some context before I get into the questions, which is, according to the World Bank, more than 5 million women, children, and adolescents die from preventable health conditions every year, despite the fact that women represent 70% of the world's healthcare and social workers. So definitely some massive gaps there. I'll start with you, Jen, and what are the primary challenges, would you say, that women face in achieving economic power, and what strategies can be implemented to remove these barriers, particularly in regions like sub-Saharan Africa and South Asia?
Yes, thanks so much. I'm just really honored to be here with everyone in this room and with you all as my co-conversationalists. I'm honored to be representing the Bill and Melinda Gates Foundation, and the core of our values state that all lives have equal value, and that everyone deserves the chance to live a healthy and productive life. And I think when we look around the world, time and time again, we see that that is just not true for everyone, and in particular, women and girls. And so we've been doing a lot of research around what we can do to address those challenges. And aside from those values, we have another sort of guiding principle, and that is to look at the data. And when we do look at the data, I think three things sort of jump right out at us. I heard someone, they say the data is screaming, and I love that. And it's three main things. The first thing there is around helping women achieve economic power through thinking through how they can access additional capital and making sure that they have access to the same amount of funds and resources that men have when they're trying to grow their own businesses. Because we know when we look at the data that already around the world, and particularly in low-income settings, 17% of women are already entrepreneurs, and another 40% would want to be that. They want to own their own businesses. They want to control their own economic livelihood. And the thing that is holding them back is access to capital. They can't get loans. They can't get that seed money. And so we're asking these people to be hustlers, to strive, to make something of themselves, and they can't even get their foot in the door because they're not playing with equal resources like the men that they are competing with are. So that's the first thing we need to address. We just need to get cash into the hands of women. I think the second thing that we're finding is that we need to look toward the future. And I've been sort of traveling to these conferences, and there are these buzzwords, and the one that I keep hearing over and over again is around digital public infrastructure. And I hear digital public infrastructure, and I think, oh, what the heck is that? But it really is thinking about how we're not sort of building toward an economy in the past, but one in the future. And the fact that we all are sitting here with cell phones in our hands, and that's the future of how we're going to be powering our economies, and how women are doing everyday tasks and building their companies and their businesses through this digital public infrastructure, through the fact that they need to be able to do their banking and their commerce through the future of technology. And so we're working to address the needs that women have to meet that sort of new economic future, making sure that they have digital identification, making sure they have access to online bank accounts, and making sure that they're ready to compete, not for the economies of the past, but for the economies of the future. And I think when we're looking at the data now, we find that there are 260 million more men online than women, and that gap is growing every day, and that's not the direction we need to be heading. So we need to be addressing those gaps now and building toward the future. And then the last thing we'll call out here, and the one that makes me the most upset, the most angry, are what we call these basic barriers. And basic barriers is sort of a catch-all term, but it just encompasses all the little things that get in the way of women being successful. Everything from them not having access to their own bodily autonomy and access to quality women's healthcare. I think, Roopa, you're going to speak to that a little later, to the lack of affordable childcare. We're calling it a crisis now, but it's been there for years and years. To the fact that women don't have the basic tools they need to be successful in their businesses that they're running. I think we look again at the data and we find that the majority of farmers in the world are women. They're small shareholder farmers, and they can't access the basic tools they need to do their work. They don't get the capital loans to improve their businesses. They don't have the tools that they need to make their farms succeed. And so these are just basic low-hanging fruit things that we need to address to make sure that women are successful. And these are the three main categories that we're looking at, but we also find that underlying all of that is this issue of women's leadership. And that's why we're just so excited to be here at this conference to learn and to grow our portfolio in that area. I know we have to sort of wrap up here, but I know that it's a space where a lot of women in this room have a lot of great background, and we're excited to learn there. We've got a great new program that we're investing in, and we're really looking at the three sort of main areas that we're finding will have the most impact in women in economics, women in law, and women in health. And so you asked a quick question, and that's sort of a long answer, but we're just super excited to be partnering and doing this work.
No, the context is important. Thank you. Obi, I'd like you to add on to that. Jen has mentioned a lot of these gaps, the basic ones, the more complex ones. What are your thoughts as well on these challenges and how we can begin to solve them?
I think one thing we know is that the gender stereotyping basically boxed women into low productivity activities. And so even though we spend a lot of time talking about the basic things that women do that are not paid for, unpaid labor activities, but even worse is that the ones that women find themselves doing are typically low productivity. And because of a lack of access to the opportunity for building up the productivity levels and skills for women in a diverse range of economic activities, women get stuck in the low productivity. So, I mean, you look at the African economy, 60 to 70% of it is what we call informality. Informality economies are low productivity segments of the economy. And with those kinds of activities of subsistence agriculture or, low productivity services sector, on the continent today, services is more than 50% of the GDP, but it's low productivity. So if you want to offer a larger spectrum of economic opportunity, economic participation for women in these societies, you really have to be saying, what are the kinds of services that women need in order to build up their productivity levels? And that's where you begin to think in terms of those barriers. Some of the immediate barriers would be education, and then technical skills. Otherwise, if somebody, people just sort of say, find capital for them. Capital is very important. I mean, according to the studies that we had, at the time that I was VP at the World Bank, it was very clear that, we really needed to invest in those kinds of technical skills, because just merely finding capital for the women really exposed them to a lack of capacity to make certain kinds of decisions about sectors of the economy that they were interested in. You also had to do with access to markets. Mm-hmm. Access to market, access to asset. Women don't build up assets. And so when inflation strikes, who do you think gets beaten first? The women. It erodes their capabilities. Access to networks, combinations and collaborations. I always say that because women are eking out a living, it appears like small is beautiful, but small is no longer beautiful. Women need scale. And so the ways to create those kinds of impetus and opportunities have to be very deliberate. And that's where, no matter how much we would love to sentimentally talk about women economic empowerment, we must be evidence-based. No two women are facing the same sets of barriers. Even when they are in the same sector, even when they are in the same economy, they are so diversified in terms of what it is that we must address. And so we must allow evidence to drive us in the solution part for women. Like I normally say, my mantra on all issues is, in God I trust. Every other person must bring their data.
Because we need that.
Yes.
Absolutely. It's interesting, we're almost like speaking to an unlearning and reset in terms of how we're thinking of scaling, of putting opportunity and finances in the hands of women. And I think you've spoken to that, looking at the fact that not everybody has the same challenges, looking at the fact that, yes, you can put capital, but what about addressing some of the other needs? Roopa, you can feel free to add on to that, but the question I wanted to ask you is how we can address gender-related disparities in access to healthcare services and quality of care, especially in low and middle-income countries.
Great, thank you, Janet, and great to be with these amazing conversationalists and panelists. What I'm here to do is really make the case that the health sector can be the exemplar sector when it comes to achieving gender equity. Just to give you the example, you opened the session today, Janet, by saying the health sector has 70% of its health care workers are women, yet when we take a look at leadership, only 25% of those leadership roles are occupied by women. What that means is we lose out on their expertise, and that expertise means that health systems continue to be designed by men, for men, led by men. I'm going to say that again. Health systems continue to be designed, led by men, and therefore they fail all of society. So if we want to use the health sector, the great thing is we already have the talent pipeline. We have a majority female health workforce that has the expertise. So how do we drive that agenda forward? I'm going to give an example, and I want to actually build on Obi's point, particularly in low middle income countries. There's an entire cadre of health workers called community health workers. They may be called community volunteer workers because majority of them are unpaid or stipend based. To give you a number, 6 million women health workers around the world are currently unpaid and underpaid. 6 million. Now, if we could formalize that, going back to your point, giving women productivity because they are clearly productive. Data has shown that when you engage women community health workers, they reduce maternal mortality. There's hard data showing this. So how do we do this? Women in Global Health, we make the case using the International Labor Organization framework, the 5 Rs. If you all don't know it, please take out your little notebook and write this one down. The 5 Rs are first, recognize the contributions that women are making. Second, reward it. Third, redistribute it. This means that we also need to get men engaged to take on the care responsibilities. Then we also need to think about giving the representation so that women can have a platform to talk about what are the challenges they're facing to be formalized. Now, this 5R framework is critical because it allows to formalize the informal health sector, and then we tap into this triple gender dividend. Because of when women are formalizing the health sector, we're going to fill the health workforce shortage gapage. We're going to help achieve universal health coverage. We know that women's health needs are not being met across the life course. The entire women's health agenda across the life course, including their sexual reproductive health and rights. I'm glad Jen already talked about the bodily autonomy. To achieve those goals, we need a workforce that understands and responds and meets women in their households, in their communities, and the community health workers are the pathway forward. So I make the case the health sector is an exemplar sector. If we do things in a gender transformative way, let's make sure the head, the heart, and the pocket match up.
Head, heart, and pocket. And if we have time, it would be great to go back to those 5 Rs. I think it's important that we're able to resonate with that. Jen, given the stagnation in public health indicators, despite increased healthcare spending, which we've heard, what innovative approaches can be taken to improve, especially maternal child health, and reduce non-communicable diseases in sub-Saharan Africa and South Asia? And I'll pose the same question to everyone, but we'll start with you.
Yeah, I mean, I think there's a lot to be excited about. I think we're coming off of this moment where the entire world sort of stopped and focused on global health for the first time in a long time. And I think coming out of that, there's a lot of energy, excitement to continue innovating. And so some of the things that we're seeing are new innovations in family planning and contraception. I think there's really great new tools out there to help make it more accessible to all women, and no matter where they're coming from. I think we've seen some really cool innovations around things like portable AI-powered ultrasounds that we can bring into places that those technologies were previously unable to get to because of technological barriers. And so I think as we continue to have this momentum and focus on global health, we can continue to advance and really leverage technology for its ultimate potential. I think what I'm worried about is that we'll shift in conversation, we'll shift in our priorities, and we won't continue this conversation. But I know that the people in this room, I think if we have sort of time for one call to action, is to keep up this conversation and to keep sort of pushing us forward, and to not sort of stagnate and think that we've done good enough, because there's always sort of more we can achieve together.
Thank you for speaking to that, Jen. And Obi, maybe to echo what she just said about sometimes this shifting priorities, and there's momentum and then suddenly there's something else that catches the attention, and in many ways that can sort of hamper the growth that maybe would have started. Your thoughts as well on innovative approaches, but also what else we need to do to make sure that this continues to be prioritized?
I think that really we saw with COVID that health is economy, and economy is health. I mean, anyone coming out of the COVID period not realizing that we don't leave health in isolation from the way we're thinking of economy. The usual thing is for the Minister of Health to be abandoned by everyone, and the people in the economic team just face economic growth. Well, economic growth collapsed because health collapsed. Yeah. We saw it with the pandemic. And so being able to engage conversations around these matters in ways that bring many more people to the table wanting to solve the problem, it just shifts the composition of teams that are working to find solutions to health issues. The second part of it is that we've seen more and more the kind of assertiveness that communities bring to the agenda on health, and we should do more with that. There's this whole sense of we are the experts and you do what we say. That's over. That's passé. We do need the health system to respond to the kind of knowledge. There's a certain level of democratization of knowledge around issues on health and education, and we know that the combination of health and education form the basis of citizens' productivity and competitiveness. So they want more voice at how solutions are generated to those needs. We need to pay attention. It's part of the innovation in the health sector. We also need to recognize that private delivery of health services in environments where governance issues stand in the way of effective and efficient use of public resources to deliver basic health services to people is a thing. It is a thing. So how we ensure that public-private partnerships and solutions become acceptable without the people in the health sector or the education sector feeling that they need to fight every other providers. I think there's a lot to discuss, actually.
Yeah, it's very layered when you say that, because we know that PPPs are massive in terms of progressing this agenda. Yes. But to your point, sometimes there's that push and pull of trust and not really, and yet it's integrating all that makes the difference.
Yes.
Roopa, what would you want to add to that?
Yeah, I would just build on an example in the health sector as strengthening primary health care. That is an example of where you empower women in their communities to access their health services, but also to strengthen the primary health care workforce. It sounds like an innovative idea, but it's one that's gotten lost in time. And so there's a global effort to strengthen primary health care, and that is incredibly promising, and it needs to be a multi-sectorial conversation. And to bring it back on gender, women in the health sector, they're fed up. They're resigning at high numbers in high-income countries, and that's impacting low-income countries as women health workers migrate, and that's collapsing health systems. Women are saying, you know what? we don't want to be the triple burden anymore. We don't want to face that triple burden. They want to break away from the past, which has actually put more care responsibilities on women during the pandemic. So these discussions on health, economy must always have a gender aspect to it. And the health sector, again, I make the case, can be the exemplar, and to all the policymakers here in the room, this is a sector that you can change the social contract in health to be much more gender equal.
And frankly speaking, I think that we need to get many more people, many more of the women in the health sector running for office.
Yeah.
We really need them to pay attention to the politics. The truth is that the politics is trumping everything. Politics trumps economy, trumps health, trumps education, trumps life. Pun intended.
Trump's life, pun intended. And on that note, I think
we need more women in politics, essentially.
Right.
Especially the one in the health sector, because the Messiah is going to come later. But right now, women have to be their own Messiah by knowing that if we stayed outside of politics and we're screaming about all these sectors, nobody is going to pay that much attention.
Can't be on the sidelines.
Yes.
Have to be in there. I think that's a great call to action as well. It's just making sure that there's more participation and that we're not on the sidelines.
Go, Roopa.
Yeah, more power into the hands of women.
No,
in
you
health.
go for politics.
Thank you, everyone, my amazing panel.
Look at that.